So this is our concept map for this semester, and it's
Montana Hicks,
Laura Nazarenas.
and Melissa Gardner.
Alright, so we're going to go over some of the assessments we covered, and then the evaluation process. Some important properties you want in the assessments you use are reliability and validity. And some characteristics to consider when choosing an assessment are the area of performance skills and client factors measured, and the structure of the assessment, and the sensibility of the assessment. And some assessment tools describe occupational performance, determine nature and severity of impairments, assess the need for therapy interventions. They measure the progress and establish a baseline of a client's performance. They're used to monitor change and used to predict a client's prognosis.
Okay, so now I'm going to talk about the semi-structured interview assessments. The main one we covered in class was the COPM, and it just looks at the perceptions of self-care, productivity, and leisure tasks that they have difficulty performing, and also the importance of the tasks to them. And then some other semi-structured interview assessments are the occupational performance history interview and the occupational circumstances assessments interview and rating scale. Okay, now we'll look at the roles and responsibilities assessments. The main one we looked at also was the role checklist. It assesses clients' value of their roles and intentions and motivation to perform the tasks of their life roles. And it also assesses their perceptions of change in roles associated with health status. So it has two different parts of defined roles. The first part examines the client's past, present, and future intentions related to performance of each role, and the second part examines the value they assign to each role. Some other assessments in this category are the occupational questionnaire, the role change assessment, the routine task inventory, and the occupational self-assessment. Okay, next is leisure, and the main assessment in this one is the activity card sort. There's three different versions: community, institution-based, and clients in recovery. And it elicits the level of participation in IADLs, low-demand leisure activities, high-demand leisure activities, and social activities. It has 89 activity photo cards that the client sorts into different categories. Some of them are never done, no longer do after injury or illness, continue to do after injury or illness, have started since injury or illness, do less after, and have given up since injury or illness. Some other assessments in this category are the leisure assessment inventory, leisure boredom scale, leisure competence measure, leisure diagnostic battery, leisure satisfaction scale, modified activity interest checklist, and not that. Okay, so the next category is the ADLs and IADL assessments. We looked at 4 of these ones in class. The first one is the KELS, and it has 17 task groups divided into 5 categories: self-care, safety and health, money management, transportation and telephone, and work and leisure. The next one is the EFPT. It has 4 tasks that it looks at: making oatmeal, making a phone call, managing medication, and paying bills. It also has 32 items total, with an initial hand washing task that are scored based on these criteria: initiation, organization, sequencing, safety and judgment, and task completion. The next one we're going to look at is PASS, which has 26 items that assess living skills in the home or clinic. There's 2 different versions for it. And there's 5 functional mobility tasks, 3 personal care, and 18 home management or IDL tasks. The last one in this section that we went over was FEM, and it measures the level of disability in 18 items on a 7-point scale to determine functional changes, and it's usually done at admission and discharge of inpatient rehab. The main areas it looks at are self-care, sphincter control, transfers, locomotion, communication, and social cognition. And then some other assessments in this are listed right here. There's the AMPS, A1, Kleinbill Activities of Daily Living Scale, Assessment of Living Skills and Resources, the Kitchen Task Assessment, and Milwaukee Evaluation of Daily Living Skills.
Okay, now we're going to look at some of the motor assessments that we covered this semester. There's quite a few. We also added range of motion from last semester with the values here. In class, we went over the Bennett hand tool dexterity assessment. And this is the general assessment of an individual's skills in using ordinary mechanic tools, and it's occupation-based. We also looked at the Jepson-Taylor hand function, and its purpose is to measure the effective use of hands in everyday activities. We included the modified Ashworth scale, which looks at muscle tone, with 0 being no increase in tone and 4 being rigid inflection and extension. The box and block test looks at gross manual dexterity. We also included the Wolf motor function test, and its purpose is to measure the motor ability through time, task, and functional task. The Groove pegboard test, its purpose is to measure manipulative dexterity, manual dexterity, and it also looks at visual motor coordination. Another assessment for strength is grip and pinch. This is for people who are having trouble generating force in their fingers or hands. And then we also included the manual muscle testing grading. And the 9-hole peg test, which is, its purpose is to assess fine motor coordination. Some other assessments listed were the Fugel-Meyer, Falls efficacy scale, timed up and go, Minnesota rate of manipulation test. For sensation assessments, we have tactile localization, which is just asking the client to point to where they were touched. 2-point discrimination, which is tested with the fingertips, and you start with 5 between the 2 testing points. Touch pressure, which is light touch, and just asking the client if they were touched. Kinesthesia, joint position, asking the client if the arm was moved up or down. Then we also have pain, temperature, proprioception, which is joint motion, moving the extremity up and down several times and hold. And then the Sims monofilament test, and this assesses sensation using color-coded monofilaments that differ in thickness, and it measures diminishing and returning cutaneous sensation. And then others listed are the Moberg pickup, the numeric pain rating scale, and brief pain inventory.
Okay, so now on to cognition assessments. The 2 main ones we covered were the LODCA and the TCA. And so the LODCA has a couple versions depending on the population you're using or assessing. And it assesses orientation, visual perception, spatial perception, motor praxis, visuomotor organization, and thinking operations, abstract reasoning. It's not occupation-based, and it's pretty easy to administer. It comes with the booklet and instructions on how to administer. And some of the strengths are that it's criterion reference, and it tests many different areas of cognition, and that there's different versions. And then the TCA, it measures, which stands for Toglia Category Assessment, and it emphasizes qualitative aspects of performance and is based on dynamic interactional principle of testing, examines the client's abilities to profit from cues and or task modifications, and it was created to be a supplement conventional measurement of categorization and reasoning to provide information relevant to rehabilitation. It's commonly used in adults with brain injury or psychiatric illnesses. It's a pretty short assessment. And then the strengths are that it's portable, it can be used at bedside, it's quick to administer, uses familiar items, and links assessment results with treatment. So it includes 18 large and small plastic utensils with all possible combinations of the following: large and small, green, yellow, and red, spoon, knife, and fork, and they sort them. And then vision and perception. So one way to assess vision is testing their visual acuities or their visual field. And here are the ranges, normal ranges for the visual field testing. And then some of the assessments used are the Behavioral Inattention Test, Bell's Test, Benton Visual Retention Test, Brain Injury Visual Assessment Battery for Adults, Clock Drawing Test, Hooper Visual Organization Test, Judgment of Line Orientation, Occupational Therapy Adult Perceptual Screening. And one of the ones we discussed in class was the MVPT, Motor Free Visual Perception Test. And it assesses an individual's visual perceptual ability. It's not occupation-based. It's a short administration, just 25 minutes. Some of the strengths are that it's quick, reliable, and a valid measure of overall visual perceptual ability. And it's the test administration is included in the booklet, and there's like a flip book involved. And then another assessment is the Rivermead Perceptual Assessment. And then lastly, home and safety assessments. The main one we covered in class was SAFER, and it assesses a person's safety in his or her home or community performing daily activities. So it identifies safety concerns in the home and then assesses if the person is capable of responding to safety situations. So it covers 97 items with 14 sections, which include living situation, mobility, kitchen, fire hazards, eating, household, dressing, grooming, bathroom, medication, communication, wandering, memory aids, and general. So target population, mainly geriatric, but it can be for any adults in the home environment. And its strengths are that it's comprehensive with a variety of areas to assess, it's quick and easy, client-centered and user-friendly. And then we didn't talk too much about Westmead Home Safety Assessment, but it's also used in adults to identify fall risks in the home environment and profile information such as their fall history, support system, and mobility status. And then some other ones we didn't really touch on were the Home Assessment Profile, Home Environment Assessment Protocol, Housing Enabler, Home Falls and Accidents Screening Tool, and then Home and Community Environment Instrument. And so that's all the assessments we covered this semester.